welcome back to this week's episode of the podcast. Today, we do have a guest. We have Dr. Harris. She is an endocrinologist and diplomate of the American Board of Obesity Medicine, and she practices at Scripps in San Diego at the Weight Management Center, which is one of the largest insurance-based weight management centers in the country. So she has tons of experience, and I have invited her here today to talk about binge eating disorder. Binge eating disorder is actually a really common condition, and I find that most of my patients, when I diagnose them with it, have never heard of it before. So Dr. Samantha Harris is a leading expert on binge eating disorder. She has written one of these fantastic scientific articles about some of the different medication strategies we can use for binge eating. So that is part of why I invited her on today. Really excited to have her talk with us about what binge eating disorder is, how we can treat it, how you can know if maybe you or someone you love has it. So without further ado, let me introduce Dr. Harris. Dr. Harris, tell us about yourself. How did you get into helping people with their weight and your interest in binge eating disorder?
Yeah, so I have always been interested in health and wellness. I think in high school, I, had some health issues, and I really started to appreciate sort of, health and the human body and understanding it better. So I always knew I wanted to go into the healthcare field and help people. I saw people who had diabetes or struggled with their weight and developed complications. And I thought, like, how amazing would it be to be able to help people prevent those types of complications? I also had personal experience with dieting. So when I was in high school, I became, a dieter, as most of us have. And I could see sort of, how binge eating disorder could develop after a period of some type of restrictive eating plan. And it really just drove me to be passionate about sort of eating, weight, wellness, as well as eating disorders.
Great. Yeah. Sounds like we had a lot of a similar path in wanting to prevent things, right? That's so much of why I like to treat weight, is to try to prevent the problems that weight can sometimes cause. And, like you, I think as a woman growing up in the United States, like all these diets kind of make their way into your life, and, eating disorders, I think were well known and prevalent, but this diagnosis of binge eating disorder has been kind of ignored. It's kind of like a newer thing. We focused on patients who had these more restrictive disorders where they wouldn't eat, they didn't fuel their body enough, and they got a lot of health complications from that, right? Can get very sick, can be deadly. But this binge eating disorder is something that was kind of ignored. It didn't even really have a name until like the last decade. And again, I think once we kind of work with our patients a lot and maybe even our own experiences, we see that this is actually pretty common. So thanks for sharing that. So I guess to start off with, like, what is binge eating disorder? What is this? How does someone know if they have it? What does it look like? How do you describe it?
Yeah. So, the most generic sense of binge eating is eating large amounts of food characterized by feeling out of control. And, but there's, of course, like some nuances to it. And the DSM-5, so, a manual for psychiatric disorders and health disorders, has very specific criteria. So basically, they say binge eating disorder is these episodes, recurrent episodes of eating large amounts of food, usually in a short or discrete period of time, and feeling out of control. So the episodes have to be distressing, right? This is not like I went out with my girlfriends to a Mexican restaurant. I had 2,000 calories worth of tortilla chips and margaritas. And it was fine. I went home, I was like, why did I do that? But it wasn't like a distressing episode. So the episodes are super distressing, and anyone with binge eating disorder really knows that firsthand. It also needs to be accompanied by some other components. So there are 5 other components that usually accompany a binge episode, and patients need to have, or people need to have, 3 out of those 5. So things like eating when not physically hungry, eating quickly, eating until uncomfortably full, eating with embarrassment. So this is people who might be hiding food from others, might put the empty Raptors at the bottom of the garbage so that their spouse doesn't know that they ate, all of this food after they went to bed at night, after the spouse went to bed at night. or, stopping and getting a fast food restaurant meal before you go home and disposing of the wrappers before you even make it home or in the garbage that's in the garage, stuff like that. Can be one of the five, criteria, of which you need to have three, can also be just being like really mad at yourself. And a lot of these people are trying to lose weight, right? Like they're trying to lose weight, they're sticking to these really healthy eating plans, and then something happens, either a strong urge, or they go out to eat, or, some emotional day, or maybe it's a woman who has her about to get her menstrual cycle, and something hormonal sort of leads to this trigger. And they're so mad at themselves. They're guilty, they're ashamed, they're beating themselves up. Like, why did I do that? I've been so good all week. I lost weight. And now here I've gone and done something totally counterproductive to what my goal was. So that's really like what the criteria are, but you also cannot be purging. So if somebody binge eats and then takes laxatives to compensate for it or induces vomiting, that is not binge eating disorder. That's a form of bulimia.
Yeah, so it definitely can get a little technical and should be diagnosed by a professional. But our goal here today, I think, is to kind of introduce people to this concept because, again, like I've seen in clinic, I don't know if this has been your experience, when I make this diagnosis for someone, they're like, I've never even heard of that, right? I didn't know that this was a thing. It's pretty rare that someone comes to me with the diagnosis or thinking that they have this. So want to like introduce this concept because we treat it differently, right? So like you said, a lot of people with binge eating disorder do want to lose weight because sometimes it does cause weight gain. And so it's pretty common that if someone's seeking weight loss help, that they may have this. So I think it's really important for us to screen for it. It's definitely something I look for in any patient that comes my way. And one of the things that can be hard to wrap your head around is that if you do have this diagnosis of binge eating disorder, we actually usually focus on treating binge eating disorder first and don't focus on weight loss. And we really have to get these binge episodes under control and fix that biology before we can even think about weight loss. And some experts say like we should never be focused on weight loss if you have binge eating disorder, which I personally don't agree with. I think we just need to treat the binge eating first. I think it's unfair to say you can never try to lose weight. What are your thoughts on that?
Yeah, so I'm actually glad you brought that up. And I have gone into debates, actually. I've spoken with like a dietitian who specializes in binge eating disorder. And she also is of that mentality, like no diet, no restriction, no focus on weight, body acceptance, all these things. But the problem is like a lot of people developed binge eating disorder because they wanted to lose weight. They were dissatisfied with themselves. Like there are a lot of causes and we can talk about them, like genetic and medication. But I find in my practice, the most common precipitant for binge eating disorder was a period of time in which someone was restricted, right? Where they wanted to lose weight. And there's this whole explanation for why that happens. But so if someone comes to you, they're not usually coming to you for binge eating disorder, right? Like less than 20% of people with binge eating disorder are actually seeking treatment for their disorder. They're usually coming to you because they want to lose weight. And if you tell them like, we're not going to focus on weight, body acceptance, don't restrict any certain food groups, like let's not worry about your weight, like that can be hard for them after spending years of trying to lose weight. So honestly, that is not always my approach. Like I won't tell them like, you need to go on a super restricted diet, you need to eliminate a food group, none of that. Like I usually avoid things like intermittent fasting because skipping meals, especially in the morning, can lead to like increased food intake later in the day and more likelihood of binge eating. So like regular meals, but I still think you can lose weight while treating binge eating disorder. And I think that if you treat both hand in hand, patients are more likely, or people are more likely to continue following with you, because I think there's actually data that shows that if you just focus on treating the binge eating disorder and no effect on weight, or even if it leads to weight gain, patients are less likely to follow up with that type of intervention. Because they want to lose weight. And
right. And sometimes the weight is also impacting their health. Some of the patients I've had with the most extreme binge eating disorder also do have a lot of medical problems related to their weight. They might have diabetes. They might have pseudotumor cerebrae, which are these, this terrible process in your brain that can occur. Like there's these really consequences that can happen. I think it's unfair to say, we're only going to focus on binge eating. We're not going to treat the weight. So cool. We're going to cover more on that, I think, later. I want to make sure we're like kind of clear on what this is, because again, a lot of people don't know what it is. And there is definitely a relationship between binge eating disorder and weight, right? It is a reason why people can struggle with their weight. But one of the super interesting things that I think gets ignored about this all the time is I think it's about half the people with binge eating disorder actually are a normal weight. Right? Does that statistic sound right? Have you seen that? Like, it doesn't mean that you have obesity or that you have a problem with your weight, but that's who seems to seek help. I haven't had a lot of people in my practice who I've diagnosed this with, who do not have a struggle with their weight, but probably because it's not quite as bothersome if you're able to maintain a normal weight and you have these symptoms. So I don't know. That's one of the things that always surprises me was when we look at the data that, a lot of people who have this actually don't struggle with their weight. They just have all these symptoms of feeling out of control, eating more food than is normal in that time period, maybe feeling physically sick from it, eating in secret. Like those behaviors can all exist separate from weight. And then also certainly, sometimes people who don't struggle with their weight kind of assume everyone who is struggling with their weight has some sort of binge eating or emotional eating going on. And that's also not the case, right? Not everyone with weight is struggling with loss of control eating. So I think those are just some important things I wanted to point out, as we go into this, that these things are not always linked with someone's weight. Okay, so moving on from that, I think it's also important. You mentioned, this is not going to the Mexican restaurant and eating too many chips, right? And I have people all the time when I'm trying to talk about this who they'll be like, oh, I totally binge. And I'm like, okay, tell me what you mean by that. And they'll say, I go to a restaurant and I know I shouldn't eat the entire burger and French fries, but I eat the whole thing. And then I'm like, why did I do that? And that in and of itself is really not like a binge and not indicative of binge eating disorder, right? That's a typical amount of overeating that maybe is not great for your health, probably not going to help you lose weight, but is not disordered, right? How many people are eating an entire cheeseburger and French fries today? Like that's not an abnormal eating pattern, right? So I think that distinction between, not eating the way you'd want to be healthy versus a true binge episode's really different. Can you describe a little bit what a binge episode might look like for someone?
Yeah, absolutely. And actually, what you were saying too about how someone might go and overeat, one thing that we didn't talk about is the frequency in which these episodes need to occur in order to be considered binge eating disorder. And per the DSM, they need to happen at least once per week for at least 3 months continuously to be called binge eating disorder. Although I do think that people can have binge eating disorder with not necessarily having episodes once per week, but if they're distressing and they're accompanied by all of those symptoms, like to me, that still is a form of binge eating disorder. So for example, a lot of times this is what I see in my practice. A patient is on some type of restrictive eating plan. Like let's say they're using MyFitnessPal and they're counting calories or doing Noom or Weight Watchers. They'll do really well for a period of time, whether it's days or a few weeks or, XYZ, some period of time, a finite period where they're on plan. Usually it's just a few days. And then maybe the weekend comes, or maybe they're more emotional, or maybe they're tired, or for whatever reason, they start to think more about food and they develop this like intense urge to eat. And it's usually a certain food. A lot of times it's like a forbidden food. It's usually a highly palatable food that's both high in carbohydrates and fat. So, a burger, a pizza, sweets, cheesecake, ice cream, something that they will think about and feel almost like an addictive tendency, like for somebody who was like jonesing for a drug or a medication where they're thinking about it. A lot of times I see these people will eat really healthy during the day. They might skip breakfast, maybe doing a form of intermittent fasting. And then when the evening hours come, it's like they lose complete control, and it might happen at dinner. It might happen after dinner. A lot of times it's after dinner. Like the evening hours are a huge struggle for a lot of people for various reasons. And then they might find themselves going through the pantry, looking for something in particular, like maybe chocolate covered pretzels are their thing, or maybe cookies that they know they had left over from their kid's birthday party the weekend prior. And then they might say, okay, I'll just have one. And then they literally can't stop themselves and they'll eat a really large amount. And there's no defined large amount. It's not like you need to eat 3 times the normal amount, but it's basically clearly more than the average person would eat in that time frame, in that sitting. And it could be 1,000 calories, 2,000 calories in one sitting. It could be 10,000 calories. But this is somebody who eats a pint of ice cream, a sleeve of cookies, the entire container of Oreos, a box of cereal, and literally, maybe with milk, and they just can't stop themselves. They feel out of control. It usually happens within an hour or two. Then they might be like, why did I do that? I feel sick to my stomach. I feel like I'm going to throw up. Occasionally people do throw up without even inducing vomiting, but because they've eaten so much, they feel so sick afterwards. They might hide the wrappers from what they've done. Like I said, at the bottom of garbage, they don't want people to know. Maybe they waited until their family went to bed before they came and did this. Maybe they were doing it while watching TV, and in some ways were like a little bit distracted. So it can vary in severity. It can vary in frequency, but usually when somebody says like, oh, I totally binge eat, I start to say like, okay, large amounts, you feel out of control, describe it for me. And then if it's kind of like, I'm not so sure, I'll say like, okay, here are the diagnostic criteria per the DSM, that I describe it. And patients are either like, oh my God, that is totally me, or like, oh no, I don't have binge eating disorder. But sometimes when I describe it, patients are just like, I had no idea. I mean, you are literally reading my life to me out of like a textbook. And it like is this aha moment where they thought they had some character flaw or willpower problem, motivation. They didn't realize it was like a true medical disease and condition.
I think that's great to point out that this really is a medical problem, right? This is a disease, it's a disorder, and there's treatment for it too, right? And that treatment is not to try harder, to try a more strict plan. We actually have interventions that can be helpful for this. But the first thing is recognizing it, right? And if you just continue to say like, I just need to try harder. I need to try a different plan. A lot of times people just keep trying different plans, right? They're like, well, intermittent fasting worked for my friend. Keto worked for my friend. This meal replacement program worked with my friend. And all those strategies might work great for some people. But if you have this tendency towards binge eating disorder, or you have binge eating disorder, those plans probably are not going to work for you, right? Because like you said, you stick with it for a while. And then when that trigger occurs, it rebounds in a dramatic way. It's not like, oh, I had a cookie. It's I ate all of the cookies and I couldn't stop. And I had this loss of control. And people truly do feel like it's out of their control, right? Like they don't realize that they've eaten all the cookies until they're gone, right? Like the whole sleeve is just gone, for example, or the whole thing of ice cream is gone, or the whole box of crackers is gone. And it very much feels out of control. But they're told so much by society that it's something they should be able to control, that they just keep trying harder, when reality is like acknowledging that this is a disorder and actually doing something about it is how we're gonna actually change things and get results. So other than first recognizing it, diagnosing it, coming to terms with it, what are some of the treatment options that we have available for binge eating disorder?
Yeah. So I approach it in a lot of ways the same way I approach to anyone that comes to talk to me about weight loss. And of course, like I focus on the binge eating component, but anytime someone comes to see me for weight loss, there are 5 topics that I go through. So I talk about their eating habits, their exercise, their mood or mental health, which in particular is important for binge eating disorder, medications, and then potentially surgery or bariatric surgery if they qualify for it. And none of those are completely excluded to somebody who suffers from binge eating disorder. So I still talk to them about all of them. But so for example, an eating plan. So there's data that you can do a restrictive eating plan in someone with binge eating disorder. And in some events, it doesn't actually lead to worsening of binge eating disorder. Like once somebody has established it, there are some restrictive plans. Like for example, I don't recommend keto to everyone. I know there are some providers that do that, but some people like find that being in the state of ketosis like provides them instant relief from binge eating disorder. Others find that doing low carb, and then the second they eat any type of carb, they go completely crazy and lose all control. Like that is not a good person for that. But you can still do dietary interventions, just not as extreme, not skipping meals, still trying to focus on calories earlier in the day. Exercise, there's data that actually adding exercise to various interventions, behavioral, dietary, can also help with binge eating disorder. From a mental health and mood, I have a list of psychologists local to San Diego who specialize in eating disorders. I have, recommendations for inpatient if I think somebody really needs that, psychiatrists that are local who can also help them. CBT, so cognitive behavioral therapy, has a good amount of data for improvement in binge eating disorder as long as it's kind of continued long term.
So therapy, right? Like we say cognitive behavioral therapy, but most of the time that's like a specific type of therapy,
someone
right?
who understands eating disorders, right?
Yes.
Like not just with anybody, but really looking for a specialist who understands the complexities of the disease. Medications. So medications are like my favorite when it comes to binge eating disorder. I'm going to be honest with you because I'm a medical provider, right? I'm a medical doctor. I'm not a specialist in nutrition. I know a lot about nutrition, but talking about all the macronutrient breakdowns, like that's not really my thing. And I don't get enough time with patients to, sit and talk to them about it. I was going to say I don't have a psychology background, but that's not true. I do have a bachelor's in psychology, but I'm not a psychologist. I don't know how to do CBT or DBT directly with the patient to help them. So I do have to outsource. And one thing I will say with any eating disorder is you need to outsource. Like there is no one person that I think can take on treatment of an eating disorder by themselves because it involves so many other specialties. It really takes like an interdisciplinary team.
So people should plan to see more than one person. They're probably going to need to see a therapist, but they may also want to see a doctor as well.
Exactly. So as a medical doctor, I'm telling you what I can't do, but what I can do, aside from like checking labs and putting referrals to all these people, is I can prescribe medication. And if you look at the data on medications for the treatment of binge eating disorder, the results can be so profound and so life-changing that I get such satisfaction. Like what conditions are out there that are so distressing for people to suffer from that we can provide, I don't want to say instantaneous relief, but like very rapid relief from something that's debilitating, that's excruciating for them to be living. And so it's so rewarding to be able to treat that and see how people feel so improved. So when it comes to medications, there's only one FDA approved medication for binge eating disorder. It wasn't even approved until 2015. You mentioned it's only been like 10 years since binge eating disorder was considered a true diagnosis, which is crazy to me. But anyways, only one medication is FDA approved. But there's a whole ton of medications out there that have been studied for the treatment of binge eating disorder and are technically used off-label for the treatment of binge eating disorder, as a lot of medications are used off-label. And I use them really liberally so that even while we're working on all these other things, at least we can provide patients with some sense of relief.
Yeah. Well, let's talk about the actual meds, because I think like this is how we get the information out there and people can kind of know what options might exist. These are all going to be prescription medicines, right? So this is something you'd have to talk to a physician about or another prescriber. So that may be your family physician, that may be an obesity specialist, that may be a psychiatrist. So it kind of depends. And like we said earlier with the therapist, you need someone who's aware of binge eating disorder because it is a newer diagnosis. Not every physician, not every prescriber is going to be comfortable and that knowledgeable about it. But, there certainly are people. And if your physician isn't, they should be able to refer you to someone who is. But the one that is FDA approved, right, is Vyvanse. That's the brand name of the drug, is Vyvanse. And I prescribe it quite frequently in my patients, and I feel the same way. That medication tends to give a lot of relief. I find patients go from, having binge episodes almost on a daily basis to having like one a month many times on the medication. And of course, they're often doing therapy or doing some CBT through a workbook on their own. We come up with a nutrition plan, but the medication like really is like a light switch and lets them finally kind of get relief from these out of control episodes. What's your experience with Vyvanse for your patients?
Yeah, so Vyvanse or lisdexamfetamine is the one FDA approved one. I don't use it as much as it sounds like you do. I have a handful of patients on it. There are a few reasons why it's not my go-to when it comes to binge eating disorder. And I think a lot of it comes down to patient and provider preference. But so it's scheduled, but it's a highly scheduled. I think it's scheduled 2, whereas phentermine is not quite as scheduled. So you can only prescribe 30 days, and then you're supposed to see patients every 30 days to keep refilling it, which is hard to do. It's cumbersome for both patients and providers. Some of the data, the side effects, the cardiovascular stuff, the heart rate, increase in blood pressure, that all made me a little bit nervous, partly because I think one of my mentors who I work with did some of the studies, and I think he was a little bit hesitant because of those changes. So it's just not like my preferred one. Also, it's, it's a stimulant. And if I use that medication, I don't prescribe other stimulants with it.
Sure.
So I won't use like phentermine, which is a stimulant appetite suppressant, because of the synergistic type of mechanisms that they have. So it kind of precludes me from using other medications. So it's not usually my go-to, although I do have some patients on it who are doing really well with it. My favorite medication when I'm starting out, and it really depends on patients and their preference and side effects, all those things. I love topiramate. Which is also called Topamax, a migraine and seizure medication that does have data in binge eating disorder, night eating disorder. It can be used with or without phentermine. So the brand name of the two in combination is Qsymia. Also has data. I mean, all the weight loss medications honestly have data in binge eating disorder. So I'll use any of them, whether it's Contrave, the GLP-1 agonists have data. So a lot of it comes down to like what's covered, what do patients tolerate, do they have reasons why they can't be on a certain medication? But there are a lot of options out there. Even some of the SSRIs like fluoxetine, which was studied mostly in bulimia, had shown improvement with binge eating too.
So lots of different medication options. And a lot of the ones Dr. Harris just mentioned, I talk about with Dr. Fitch. I think it's episode 10, where we talk about all the medications that we use for weight. And like you said, any of the medications that we use for weight can still be used in binge eating disorder and often help with the binge eating disorder, right? Because they help suppress appetite in various ways. And so once you have that trigger of appetite that's reduced, treating binge eating disorder gets a lot easier. Okay, so you mentioned topiramate, which I don't think we talked a whole ton about in that previous episode. So what are possible side effects or reasons someone wouldn't be able to take topiramate?
Yes. So topiramate, like I said, is the headache and migraine and seizure medication that's out there. There's a few contraindications. So number one, you absolutely don't want to get pregnant while you're taking it. It is associated with birth defects, cleft lip, cleft palate, most in particular. Kidney stones, so increased risk for kidney stones. So if someone has a history of kidney stones and that risk is still there, not like 10 years ago, they were on medication that precipitated it, then I would avoid it. Topamax or topiramate sometimes gets the nickname Dopamax, and that's because it can cause sometimes like decreased cognition, fuzzy thinking. I think that's actually a pretty common side effect. People will feel like their performance at work isn't as great, their word finding difficulties, but that's dose dependent. And I don't think patients need to be on that high of doses for binge eating disorder, even though the studies on it were on super high doses of topiramate. Yeah. Right. Other things, it can cause a change in taste, especially things that are carbonated. So they might taste flat or metallic. And then sometimes weird neuropathic symptoms. So like tingling or numbness of the fingers or the mouth or even the feet. And that's usually dose dependent. And there are some things you can do to improve that too.
Yeah. And that goes away if someone stops the medication too, right? They're not going to be stuck with these like tingly fingers forever. If that is a symptom, it'll go away when they stop the medicine. So I think that's always important to point out, right? If you have these side effects, they go away when you stop the medicine if it wasn't a fit for you. So yeah, so I think that's great that we have us both here, because I definitely utilize Vyvanse as the first line in my clinical practice. And so I love that you're like, my experience is that Topamax or topiramate works great. And really there's this whole menu of options, right? There's a lot of different options, but using a medication to help with binge eating is really key, right? Like it really does give people a lot of relief. What's your thoughts on how long someone needs to be on a medication? So when we use medications for the treatment of weight or obesity, we expect people are going to be on them sort of long-term, indefinitely, maybe forever. What's your thoughts on binge eating disorder? Do you think most people need to be on the medication forever? Have you seen people that are successful being on it for, 6 months or a year or just a couple of years?
So in my clinic, so I work in a weight management clinic. So predominantly the vast majority of patients that come see me who I diagnose with binge eating disorder are coming to see me because they want to lose weight. So to me, for them, in the same sense as someone who wants to lose weight, I consider it a chronic long-term medication. Now, if somebody, did not need to lose weight or want to lose weight and their binge eating disorder improved, I think we could always do a trial period of seeing if we can come down on the dose and see what happens. I would definitely not stop cold turkey, because some of the underlying mechanisms that might have caused the binge eating disorder might still be there. They're just kind of hidden by the medication. If you remove the medication, they might kind of come back. And I definitely...
But it is possible to get remission, right? Meaning it goes away. Some people they get, especially even just acknowledging it. I find that some people just acknowledging the binge eating and kind of figuring out what those triggers are and stopping restrictive diet they sometimes it goes away, I guess. Like people are probably going to always be at risk, but for some people, binge eating disorder does go away. It's not always something that people struggle with forever, at least in my experience. Like sometimes, again, if we get rid of the restrictive dieting and you do therapy, like sometimes it does go away.
It absolutely can. But of all the eating disorders, binge eating disorder has the longest average duration. So the average duration for someone with binge eating disorder is 14 years. Whereas
Wow.
bulimia or anorexia is usually about 6 years. So
That's a long time to live with something that's so
suffer.
distressing.
Yeah.
Okay, so in your experience, when we treat binge eating, how many people actually lose weight from treating it? And I know a lot of times you're using a medication that also, can lead to weight loss. But a lot of my patients expect, okay, once this goes away, I should lose weight. And that's not always the case in my experience, right? Treating binge eating disorder doesn't always lead to weight loss. How often do you see people lose weight with binge eating disorder? Do you sometimes see people who, they might be eating an extra 500 or 1,000 calories a day, they stop that and they don't lose weight? Do you ever see that?
I mean, it's possible. What I usually see is just that their weight loss is slower than they expected. And that might be because they're used to doing these really extreme diets. Keto with the water weight fluctuations, people can lose 3 to 5 pounds in a week, right? So people think like 2 to 3 pounds per week is normal. And that's what I did when I was doing MetaFast or OptiFast or whatever health plan. So when you're treating the binge eating disorder, the primary goal of treatment is not always weight loss, but it can be a concurrent goal. The primary goal to me is decreasing the frequency and the severity of the binge eating disorders, and hopefully with a secondary benefit of also improving their weight, either helping with weight maintenance, because usually those people are increasing in weight, or helping them lose weight. And
right. That's such a great point. Sometimes the goal, if you had been gaining weight, if you've been gaining 5, 10, 30 pounds a year, and now you're just stable, right? You're no longer gaining weight. That may be a really huge victory as well.
Totally. Like that can be the achievement. But I think people need to get comfortable, whether it's binge eating disorder or just weight loss, they need to get comfortable with slower rates of steady weight loss from things that might be more sustainable. So for example, in the beginning, I'll tell patients, yes, you might lose a pound a week or 2 pounds a week the first few weeks or the first few months, but that's rare. And honestly, my minimum goal is usually a half a pound per week, a half a pound to 1 pound per week of steady, consistent weight loss to me is more indicative of fat loss, right? Not just water weight. And we also are trying not to lose too much lean body mass either. So I think the expectation needs to be out there at the beginning of treatment so patients kind of understand what the realistic goals are.
And then you mentioned surgery, that you still offer surgery to patients with binge eating disorder. So tell me a little bit about that and, why or why not someone with binge eating disorder might consider surgery.
Absolutely. I think that statement was probably very controversial. And there are definitely medical societies that say that binge eating disorder is an absolute contraindication. And I would agree, if someone is actively binge eating, you do not want them to have surgery. And there's a multitude of reasons. They won't lose as much weight. They're at a greater risk for complications, stretching their pouch, perforations, bleeding, reoperation. Like, definitely don't want to do that. But I think that binge eating is a treatable condition. And with the right support, the right dietary interventions, mental health support, medications, if somebody can manage it or control it to a level where it's not dangerous in the setting of surgery, as long as they're being treated before, during, and after the surgical process. I mean, you have to look at the fact that a lot of these patients are presenting for weight loss. And at a bariatric surgery center, I mean, it's estimated something like 20 to 50% of the patients that are seeking bariatric surgery have binge eating disorder. Right. And so many of those are probably undiagnosed. We don't even know, and they undergo weight loss surgery. So it's out there. It's happening all the time, whether or not we're aware of it. We just need to do a good job of doing our best to manage it beforehand, making sure it's well managed during and after the process.
I agree. So I will be controversial with you. We can be controversial together on this because I've been doing this for more than a decade. And I have people where the binge eating is treated, right? Whether that's still on a medication, whether they did therapy and a medication and now they're continuing therapy, whether they've changed their lifestyle and their nutrition so that it doesn't trigger binges, like all these things. And now it's been a few years and we're like, okay, but you still have weight you want to lose or need to lose for health conditions. And sometimes I will be like, I think you're ready for surgery, right? Like, let's do surgery, right? You have all the tools, you've done all the work. The binge eating is no longer the main problem, right? We have tools, we have treated it, and like, let's move on and treat the weight. So I'm glad. I think we're on the same page that like, it's not a reason, but it needs to be treated first, right? If bariatric surgery is not going to solve binge eating disorder for most people, and it could be risky to get binge eating disorder. It could have complications if you're actively having frequent binge episodes, after you've gotten a surgery. That could be a really bad situation.
Absolutely. I totally agree.
Okay. All right. Let's see. What else? Is there anything else we didn't cover about binge eating disorders? We talked about what it is. We talked about what it kind of looks like for people. We talked about kind of treating it first as the priority. We talked about some of the treatment strategies. What else do you think is important for people to know about it?
I think one thing we didn't talk that much about are concurrent psychiatric diseases that are often seen with binge eating disorder. We talked about how like mood can affect your weight, but your weight affects your mood. It's this vicious cycle. So like a huge percentage of people, like probably 70% of people with binge eating disorder have some other psychiatric disorder at some point in their life. And primarily it's a mood disorder, but anxiety or other substance abuse. A lot of times we kind of replace one addiction with another, or we're like genetically predisposed to some type of impulsive or compulsive disease, whether it's gambling or sex addiction, smoking, alcohol abuse. They all kind of go together. And a lot of times someone quits smoking, replaces it with food, XYZ, and it has to do with sort of the neurotransmitters of the brain and dopamine and all these things. So I think making sure that all of those other things are screened for and looked at, especially in someone who has surgery, because if they're no longer eating, they might replace it with other addictions or compulsions. So
yeah, I think that's huge. Yeah. So I definitely see a lot of depression and anxiety for my patients with binge eating disorder. I see a lot of ADHD. Those two coexist a lot. And I actually think the patients that I see who have binge eating disorder and don't struggle with their weight usually also have ADHD. And it's some of that loss of control, impulse regulation, need for that dopamine hit to their brain that they get from the food. And interestingly enough, one of the medications we talked about, right, Vyvanse, it was originally approved for ADHD and then it got approved for binge eating disorder. So I guess to me, it's not shocking that I see overlap there. And I think the substance abuse, the alcohol in particular, is something I see, but I've seen it for people who are recovered from like methamphetamines or something, right? And now they've become a binge eater instead. When I get a family history on a patient and they have a strong history of alcoholism, I'm already thinking about binge eating disorder when I see that person, because I see so much overlap with alcoholism and binge eating disorder. I agree. It's like a lot of the same neurotransmitters that put people at risk. So yeah, and treating all those other things, right? Because if your depression or your ADHD or your alcohol abuse is not treated along with your binge eating disorder, that probably is not going to set you up for success either. Cool. Well, thank you so much for joining me today. Like we said, Dr. Harris is an obesity specialist like me. She's an endocrinologist. So she is an expert on binge eating disorder. Again, has written one of the amazing articles about some of the treatment options for this. If you want to follow her more, again, she's at Scripps in San Diego. And then she is also the Weight MD on Instagram. And I'm going to push her to post some more stuff again, because she posts really fun, entertaining, educational material. So I love seeing her stuff on Instagram. Any final words before we end the episode?
No, thank you for having me. I think the only thing I would say is if you're a patient, talk to your provider. I think that's the first place it starts. And if you're a provider, just start asking more, because I think we're just underdiagnosing.
Yes, definitely underdiagnosed. And there is a screening tool that physicians can use, the BEDS-7, which helps outline the symptoms too. So that's a place to default if you're not quite used to talking about this, that BEDS-7. It's kind of like a depression or anxiety screen, but it's one we use for binge eating. So, well, thank you so much for joining. And everyone, we'll have a new episode next week. Until then, take care.
Bye. Thank you.
Thank you for listening to the Dr. Francavilla Show, where we learn about all things related to weight and health. If you love this podcast, make sure to leave those 5-star reviews and share this podcast with a friend or loved one. If you have a topic about weight and health you want me to tackle, head over to the website thedrfrancavillashhow.com to submit your question. And make sure to subscribe to the podcast so you don't miss next week's episode. Take care.